Hello, I'm Dan Adamczyk, and this is the Physnovations prototype shop. I'm here to tell you a little bit about the latest from Physnovations. Is the WellStick. The WellStick is a physical therapy device. Allows you to gather data on your patients doing exercises for injuries of all types, and it also allows you to prescribe exercises for the patients to do while they take it home for the week. But basically the WellStick is a physical therapy device based on cane exercises. Walking canes are used a lot for different types of injury exercises, typically shoulder injuries, rotator cuff injuries. You do a series of exercises, pushes and pulls on a walking cane. But the disadvantage there is you can only the therapist can tell the patient push or pull till it kind of feels uncomfortable or it hurts, and then stop and do another repetition to stretch the muscles, the joints, the ligaments, or whatever is the situation. But with the WellStick, it has a built-in force sensor that can read pounds or kilograms, and it can give the patient an exact idea of how much they're pushing or pulling when they're doing their exercises. So it's a great evaluation tool to assess a patient how much they can push or pull when they've initially had an injury, and each session they can do it again and see how they're progressively getting stronger. It's not only an evaluation tool, but it does exercises as well. You can set the amount of pounds, you can set a hold time, and if you want to do a tension pull or a compression push, what you want to do. So the idea is to evaluate the patient, have them take it home and do their exercises, and it records into memory each battery of exercises, and it does a date stamp, a time stamp, so you know when the patient's doing their exercises. So a week later or whatever, when the patient comes back, you can wirelessly link up and download all the data, put it in Excel, and graph chart the patient's progress. And there's established data and norms of healing rates. You can say, is your patient healing faster than normal or kind of slow and we need to dial back a bit. Nice thing is it does so many exercises. It's not just for cane exercises and for shoulder injuries. It can be used to assess and prescribe exercises for leg, hip, foot injuries. Use it again as cane exercises, as a walking cane. How much pressure are you exerting on your foot? How much are you favoring your foot and putting it on the other foot? So it's very versatile. This is the first version, prototype, and it's fully functional with the tension and compression exercises. Also have things in this static pull, static push. The latest version covered in my patent has a dynamic pull where you actually pull and this WellStick expands outward, and you can do pull exercises, and you can also expand it out and pull it back and do pull exercises, dynamic pull, dynamic push. It can evaluate hand grip strength with sensors inside these grips where you grab on and squeeze, and there's force sensors that give the readout to the computer, and it records the hand grip strength. And the same thing applies with assessing, and you can also set up a program how much can you squeeze and hold for a certain amount of seconds, and give the patient prescribed exercises to do for the week, take home, and download the data again when they come back in. For wrist injuries, there is a device inside that allows the hand grip to pivot, twist like a motorcycle grip. You can twist overhand just like a motorcycle and assess the strength of the wrist. It can go the other way to do the exercise in the forward direction. It can just, for evaluation, just be a non-moving kind of thing, or it can actually move in a dynamic way to assess range of motion. There's sensors in that count the degrees of rotation that will assess how much the patient has a motion or not motion in the wrist. So very useful for rehabilitation and predicting healing as well. There's an attachment that you can put a hook on the WellStick and use therapy bands, rubber bands, to attach to a door frame or other device to do like pull down exercises, and will read out how much you're pulling. There is a pad that can go in that same port to use to push. If you're doing push exercises, or you have some kind of arm injury where you need something you're going to push against, it can also read tension and compression in pounds and kilograms, easily settable in the screen. It's got status indicators, it's got the digital liquid crystal display readout, it's got some buttons for selecting left and right, back buttons, enter buttons. All in one unit. It's fully rechargeable, and it's very robust. High impact plastic, soft grips. Patient can take it home. The batteries will last a very long time, weeks and weeks without a recharge. So this is just to help people heal, and just helps them all the way around by giving them exercises where they're not just pushing until it hurts. It's something quantifiable, hard data, hard numbers. You can get out into the field and start helping people, and when you can chart their progress and you can prove to them how they're getting stronger and stronger, you can justify everything that you're doing and quantify the help you're giving them, and you can prove that you're an effective therapist when you're helping people by using the WellStick. So that's basically what we have with the WellStick, another innovation from Physnovations, and hope you enjoyed it.